What causes oculogyric crisis? Have you ever wondered what happens when someone experiences an oculogyric crisis? This rare neurological reaction can be quite alarming. It involves a sudden and involuntary upward movement of both eyes. This condition is classified as a type of acute dystonia, which means it results from abnormal muscle contractions. In this case, it affects the muscles that control eye movement. So, what causes this unusual episode? The most common trigger is the use of certain medications, especially antipsychotics. These drugs block dopamine receptors in the brain. Dopamine is a neurotransmitter that plays a key role in movement coordination. When antipsychotic medications disrupt this signaling, it can lead to oculogyric crisis. First-generation antipsychotics are more frequently associated with this condition. However, second-generation antipsychotics, like risperidone, can also cause it, even at low doses. But it is not just antipsychotics that can lead to oculogyric crisis. Other drug classes can also be responsible. For instance, antiemetics, which are used to prevent nausea, certain antibiotics, antidepressants, antiepileptic drugs, and antimalarials can interfere with dopamine or other neurotransmitter systems involved in motor control. Neurological diseases can also play a role. Oculogyric crisis may arise in the context of other neurological disorders. This includes genetic movement disorders or postencephalitic syndromes, where inflammation or damage to the brain affects motor pathways. Stress can also trigger episodes of oculogyric crisis. Repeated exposure to the causative drugs can provoke these episodes as well. In the context of schizophrenia, oculogyric crisis is particularly relevant. Antipsychotic medications, which are the main treatment for schizophrenia, can induce this movement disorder as a side effect. Episodes of oculogyric crisis may come with additional symptoms. These can include restlessness, agitation, and autonomic signs like sweating or increased blood pressure. Some individuals may also experience transient psychiatric symptoms, such as hallucinations or panic attacks. Understanding the cause of oculogyric crisis in patients with schizophrenia is important for proper management. Recognizing that this condition is often drug-induced allows healthcare providers to adjust treatment plans. They may consider using anticholinergic medications to relieving symptoms and prevent misdiagnosis of worsening psychosis. Prompt treatment can improve patient comfort and adherence to schizophrenia treatment. In summary, oculogyric crisis is mainly caused by dopamine receptor-blocking drugs, particularly antipsychotics used in schizophrenia. However, it can also result from other medications and neurological conditions. This movement disorder is linked to disrupted dopamine signaling, affecting eye muscles and can be accompanied by psychiatric symptoms, making it a significant consideration in schizophrenia care.